We're speaking today with Dr. Garth Graham, Director and Global Head of Healthcare and Public Health Partnership at Google YouTube, overseeing the creation of credible health content in partnership with multiple health institutions.
Dr. Graham was the Chief Community Health Officer at CVS Health, and before that, he was President of the Aetna Foundation. He was also the Deputy Assistant Secretary at the U.S. Department of Health and Human Services under Presidents Bush and Obama. Dr. Graham, we welcome you back to Conversations on Healthcare today.
Thank you. Thank you guys for having me again.
Yeah,
it was so much fun the last time.
Great.
Yeah, it was great. And Dr. Graham, YouTube is, as you know, spearheading this effort really at a great time when so much misinformation has dominated the narrative about COVID-19 on the internet. And you've been tasked with leveraging the massive audience of YouTube. And I always amazed when I hear this number, 2 billion users per month, really to provide vetted, reliable, science-based information to a public that's quite hungry. Needless to say, you know how many clicks there are coming your way every day. Tell us a little bit about who your partners are in this endeavor, and how did you come about taking on this really important task?
Yeah, I'll start with myself first, and then back into our partners, which are so much more important. So, I have just always been like you and many of the folks on your show. I've always been obsessed with this issue of community health and impact, and being where people are, and being kind of doing the thing that could impact the most people and bring the most positive, certainly positive health impact, and not positive impact overall. So for me, part of this, what drew me to this role was, again, the impact, the amount of folks who visit the platform looking for health information, and the ability to make a difference in so many people's lives across the world. So I think for me, it was this ongoing, I would think magnetism or attraction to this idea of community health impact and reaching people where they are. Now, I think, quite frankly, I'm not the owner of that idea, because certainly I think a lot of our partners feel the same way, and I think that's why they've signed on to work with us. So, the American Public Health Association, given their own public health domestically, National Health Service, CDC, all of the different folks that we've been working with over the past year to bring health information to scale, I think share that similar viewpoint.
Well, Dr. Graham, 2 billion people. Wow, that's a lot of people. And it is a reality for anybody who's in healthcare today, sort of on the delivery side, that we know that before patients come and talk to us, they've probably already talked to Dr. Google about whatever the concern, the symptom, or the medical condition is. But with COVID, there's just been so much misinformation for people to sort through, and of course a lot of new information, and because it's new, sometimes changing. How are you formatting the YouTube COVID content to leverage the internet's influencers to get the message across that we're trying to get across to billions of people, and really all around the world? We tend to think of this as, I tend to think of it as national, but this is really a worldwide phenomenon that you're trying to influence.
Yeah, what I like to think of is, gone are the days in public health where people are looking for information from a flyer, or looking to learn about health and public health from a billboard. They're looking for it in the palm of their hands. People ask questions. They wake up at 2 a.m. in the morning worried about something. They're gonna look it up, and they're gonna try to find a source of information that hopefully is factual. So I think our goal was to marry the evidence base and the science with the engagement. So realizing that there are a lot of places where, particularly on YouTube, where people go to for information about other things. And what if we could provide evidence-based information to folks when they're looking for questions? Who would have thought, guys, that messenger RNA is going to be a topic, at the dinner table?
100%. Yeah.
Yeah, and the ability of video to kind of take complicated piece of information and make it digestible in this way where you utilize the influence and the audiences that people have to bring engaging information is I think part of, again, what attracted me, but also part of a lot of what we've been doing during COVID. So I think my goal, I think our team's goal, is to really bring the science, out of ivory towers and into people's palms and into their conversations, and really just kind of revolutionize the way science gets to the public.
Oh, that's great. Dr. Graham, close to 70% of the population has had at least one dose of the COVID vaccine in this country, but the anti-vaccination movement is formidable force. Margaret, I don't remember if it was Dr. Ashish Jha or Dr. Peter Hotez who said to us, the biggest battle we have right now, the biggest fight that we have in our country is the internet. And that was telling, because these are science people who are at this point worried about the vaccine and the distribution. And YouTube has been a hotspot for such activity in the past. And we've seen such a dramatic rise in vaccine resistance as the COVID vaccine is now rolling out all across the United States. Talk to us about your strategy for countering some of that messaging.
Yeah, the important thing here is to get science to the public at scale. So what we've done is we've worked with, we actually just did something with President Biden and Dr. Fauci and some YouTube creators as an example. We've been doing this with Dr. Fauci from actually last year, since the beginning of the pandemic, where we try to bring information to people at scale from science-based viewpoint, but using the audiences. One of the things we did earlier on was with Dr. Fauci and Trevor Noah, and really broke down a lot of the very important information, a basic piece of information people needed to know about COVID at the time. But going back to your original question, the whole idea here is to plant and have information on the platform that is credible, scientific, and evidence-based. Now, it's interesting when you had mentioned one of the earlier comments from one of our distinguished scientists about the challenges with information on the internet. That's where I see the opportunity. Because the truth of the matter is, why there's a challenge is because that's where people are.
Yeah.
And so we need to go where people are. We need to be where the community is, be where individuals are with the information. And I often think, last point I'll make on this is, I often think about this issue of misinformation like a garden. We have to pull out the weeds and pull out the misinformation, but then you need to plant with proactive information that people will gravitate to. And really, we've been very active on the misinformation front, moving over 800,000 pieces of content that have violated COVID-19 policies or anything that is not synchronous with the science. I may lead people down the wrong path. So I agree with much of what folks are concerned about. A part of why I'm in this role is to really help us tackle that issue and make sure we can get information to scale to the public.
Well, Dr. Graham, health disparities, health inequities were very real long before the COVID pandemic, but certainly the entire country, I think, has realized this at a level maybe we never did before, about the gaps in life expectancy, how much harder groups were hit, how much people's economics plus race and ethnicity factored into whether they were likely to get infected, and if they were, how sick they were going to get. You have been concerned with this your entire career, as long as we've known you for many years now at HHS, at the Aetna Foundation, and CVS Health. You were very focused on health inequity and the social determinants of health. How are you using your new role in this incredibly powerful platform to address health disparities, health inequity, to really engage populations that most need this information? You've got this incredibly powerful tool. As powerful as your tools were before, maybe this is the most powerful one yet. How are you putting this in service of those goals that you have?
Thank you for saying that. You're right. I have been, I've had the issue of health inequities as a part of the reason that gets me up in the morning, that kind of drives and has driven my career and day-to-day decisions. So think about this. Think about the ability of platforms like YouTube to empower folks from underserved communities with information. Now, there are issues that we have to continue to deal with around social determinants of health, structural racism. But I view the power of the platform is reaching communities with engaging information that allows them to make the right decisions for their communities. And in fact, during COVID, some of our primary partners were folks who were tackling health disparities with the pandemic, with the Kaiser Family Foundation, as well as folks like the Black Coalition Against COVID, and other similar groups were some of our first partners in working together. And it's because, like you said, this issue of health disparities is real, has been real for a long time, but has certainly COVID, I think, unearthed some visibility on that. So working with the partners to reach Black and Brown communities is particularly important, and also educating the community, the broader community, about the challenges within Black and Brown communities is a big part of our agenda, and how our work will continue moving forward.
We're speaking today with Dr. Garth Graham, Director and Global Head of Healthcare and Public Health Partnership at YouTube. Dr. Graham, I was thinking as you were talking about the garden, prior to COVID-19, we had sort of only one variety of plant in there, which was in-person visits, right? We only had one thing in the garden. And obviously with COVID-19 coming along, we've had this dramatic shift to and adoption of telehealth. And I think about the population we care for, 95% of them live at or near poverty. The ability to simply use your phone, you didn't necessarily have to have a smartphone, you could do telephonic, was so important, so transformational. And now we're getting to this point where there's a COVID 2.0 delivery model using telehealth and other things. And I'm wondering what your thoughts are on it. You've been in the forefront of so many transitions and transformations in healthcare, but how does YouTube's content help better communicate to patients online? And what might that system look like as you look down the future?
Oh, yeah, and that's a big part of what we're thinking about now. So thank you for asking that. So if you think about it, what telemedicine really is, again, is this idea of reaching patients where they are. You don't have to get up and put on your clothes and your shoes and socks and go to the doctor. Your doctor is coming to you in your own home. And that telemedicine is a gift that we should have been unwrapping a long time ago. So thank you, COVID, for allowing us to move faster. But as you know, it's been moving way too slowly for a long time. So that's a good thing. So we see our platform as a complement to that. This idea of getting information. So if the clinical visit is over and there's other things that patients need to read about, watch, understand, listen to, that's where they go to places like Google and YouTube to get information. And what we want there is to have scientific information that complements much in terms of what they would have had in that clinical encounter. Similar to how, in the old days, I say the old days, like last year was the old days, but when people go to in-person visits, when they're out of the visit, there are other things that are in fact impacting how they make that decision. And so in the digital realm, this is where you see platforms like ours and others, be able to supplement that information, making sure that, again, it is evidence-based, credible information that is, that engaging we're presenting the science. So really all of these tools are complementary. And certainly, as you just pointed out, COVID has accelerated that. But I don't think we'll be able to go back, because now patients and individuals and consumers know what it's like, and they know that we can do it. So I think we'll have to continue to evolve to meet people where they are.
Well, Dr. Graham, I think continuing somewhat along that theme, all signs, all data points to a real escalation in behavioral health issues, mental health issues across the lifespan, but particularly in our teenagers and our younger children as well. Everyone's very concerned about this. You were joined by experts from Harvard School of Public Health recently with some influencers and some teens. I think we still call them digital natives, although I think that's getting to be kind of an old-fashioned term already. They've been accessing the internet since pretty much they were old enough to point a finger. They're pretty comfortable, it seems, sharing their feelings online and getting help through telehealth. I know you've been studying this issue. What other solutions do you think telehealth might have to offer as we confront really a gap between not just getting teens to use telehealth, which I think is the easier lift, but just the enormous, perhaps, gap between the demand and the supply available to meet it?
Yeah, no, it's a very good question. Right now, as you just pointed out, across all populations, we are seeing increases in incidence of depression, anxiety, certain substance abuse, all of those things that I think are the sequel of the pandemic. You've seen that across the world. So, right now, what we have to think about is, as people, where are folks, Again, how do we reach them with information? How do we get, how do we link them to resources? How do we link them to, the kinds of things that are coming out from SAMHSA, the Substance Abuse and Mental Health Service Administration, the kind of things that are coming out of community groups who have created resources that are viable and impactful in general. So a big part of, as you just mentioned, what we've been working on is this idea of connecting people to resources, and also ways in which for the less serious end of the clinical spectrum, how can we educate people on coping techniques and the kinds of things that help improve their daily life. But once you get past a certain level of challenges, how to connect people, have them understand where to go and seek for more serious care. But you are so right. When you look at some of the search criteria that we've been seeing spikes on over the last couple of months, it is just emblematic of the fact that this pandemic left a lot of folks socially and emotionally burdened. And digging our way out of this is going to take us a long time. But we have to be there for people where they're at to be able to help them on this journey.
Huh. Well, that's quite interesting. And, you started this conversation off talking about one of the reasons you took the job was really giving you this incredible platform. I noted that you were at a Harvard event recently, Look Back, A Way Forward with Dr. Fauci and Karen DeSalvo, who you work with at Google Health, and Harvard's Michelle Williams. Talk to us about the engagement, though, with the user. How does a user play a role in making the internet better or making YouTube better? What's that engagement look like? Because that seems to be past the folks that we all look up to. It's really about us as a community working together.
Yeah, I love the way you asked that question. We are used to healthcare being very system-centric. Mm-hmm. So we think of the healthcare system and how we get care to the person. We rarely, there's been a lot of talk about patient-centered care, but we haven't done a good job of doing that as a national healthcare community. And that's where you think, and the funny thing about the tech industry and the way in which a lot of the technology products are made is they're very user-centric. So, you start to look at this from a totally different lens where you start with the person's journey and how they're going to interact with the system. And then how does the system change and maneuver? How does a platform deliver information? How are things created from a patient-centric, user-centric standpoint? If there's one thing, I'm so glad you asked the question. There's one thing I hope that these conversations inspire is this idea of switching the paradigm from not how we as a system deliver care, but thinking about people as they receive information, as they receive care. So a big part of our work starts with the individual sitting and looking and searching and thinking through their journey. And I think for us, and for me personally, kind of having this healthcare experience and now understanding, how we utilize these tools better, I really do think that now is time for healthcare as an industry to evolve to truly patient-centric care.
Well, I really appreciate that note of optimism and forward progress. We're speaking today with Dr. Garth Graham, Director and the Global Head of Healthcare and Public Health Partnerships at Google YouTube. You can follow his work by going to blog.youtube.news/COVID-19 education. Dr. Graham, we want to thank you always for your commitment to advancing public health, for addressing health equity, for sharing your wisdom for how technology platforms can actually enhance the goals of public health, and of course, for joining us today on Conversations on Healthcare. Thanks so much.